Does that mean that sex is easier during the ovulation period?
It is easier because there's more lubrication.
Yes.
And even there's a slight increase in even the libido of the women during that time as well. So the vaginal discharge is also helping the sperm to travel so that everything works together.
We need to work. Can we give it up for God, please? Like what? God is good. I'm still holding on to that. Have you ever had a vaginal discharge and wondered, what the heck is this? As a woman, I'm sure you all know what I'm talking about. On today's episode of On the Couch with Winnie, I have a special guest who'll be talking to us about vaginal discharge, everything we need to know about it, and how it tells us what is happening on the inside of us as women. Without further ado, let's welcome back Dr. Lewu to the couch.
Hi, Winnie. Thank you for having me again.
Thank you for coming back again.
It's always lovely to be here.
Same. And I think it was my obligation to bring you back to the couch because there's a lot of things that we need to discuss around women's health.
Absolutely.
This one, vaginal discharge, is one that has actually been on my mind for the longest time, and I really cannot wait to hear everything that you have to say about it. So first of all, we're going to go straight into the conversation. Dr. Lewu doesn't need any more introduction, but for those who are watching this segment for the first time and you don't know who she is, I think I'll just allow you introduce yourself for a bit.
Okay, so I'm Dr. Lewu. I'm a consultant gynecologist, and I currently work as the Chief Medical Director at Women's Clinic, Lagos. So I do everything that has to do with women's health. If you're talking about irregular periods, PCOS, trying to get pregnant, talking about vaginal discharge, as Winnie has brought me to talk about today, that is bothersome, I'm your go-to person. So I'm happy to be here, and I look forward to this conversation.
Okay, so let's just jump right into the conversation. Quick. My very first question, please. What is this vaginal discharge?
So a vaginal discharge literally means a discharge that is coming out of the vagina. But for the longest time, there has always been, even starting the conversation, you can see how it feels a bit uncomfortable to talk about it. It's one of those private things. But it's good that you're bringing it out there because, again, it helps women to know what is normal and what is abnormal. And today I'm really excited because I really want women to know what is normal.
Okay.
Because I think some of the normal features of what is expected of a vaginal discharge, women are treating them as abnormalities. So we're going to talk a bit about it as we progress. So vaginal discharge is something that women experience, and it varies with the time of the cycle. Whether you're close to your period, whether you're close to your ovulation, whether you're in between the mid-follicular phase or you're somewhere in the luteal phase. It changes. It varies with a lot of things. It varies with even your sexual activity, varies with options of contraceptive that you're using. So a lot of things can affect a woman's vaginal discharge, but it is part of a woman's physiological manifestation as well. Okay, so
you said the vaginal discharge is just pretty much things that are discharged out of a woman's body.
Yes, from the vagina. Through the vagina.
So, but what causes this discharge, these different discharges?
So we have variations. Again, if you notice that vaginal discharge starts at different points in a girl's life, and then it gets more as you get older and all of that. And what is responsible? What is the component of vaginal discharge? What is inside it itself? So in as much as we have the vagina that leads from the woman's reproductive health, reproductive system outside, what it entails includes the sheddings from the womb.
Okay.
That's what we call the uterus, the neck of the womb, the cervix, and even the vaginal wall itself. They are the ones that come together. So there are proteins, there are bacteria, all of those things together. There are amino acids, there are glucose, all of them together are the ones that come out as vaginal discharge. And what is responsible for this could be what is happening inside, internal factors, or what is happening outside of the reproductive organ itself, which are external factors. So what causes them, again, depends on, like I said, physiological. Let's go to the normal one. So to have a vaginal discharge first is normal.
Thank you for saying that.
That's the first thing.
Okay.
Because I've seen a lot of women that have invested thousands of naira to making sure that they don't have any discharge. To have a vaginal discharge is normal. So we're going to talk about what is considered the normal vaginal discharge. You notice that it can either be clear colored, it can be white, or off-whitish.
Sometimes very thick.
No, so that's even with the cycle.
Okay.
Yes. So
okay.
It could be that's consistency, but even in the color itself, think about clear, like water looking, or white or off-whitish. Sometimes, depending on where you are in your cycle, which we'll talk about, the consistency can change. So it can be thicker, it can be scanty, it can even be more. So in as much as it's very difficult to also quantify discharge, like period, people talk about in a day, your discharge is supposed to be like half or a tablespoon.
Okay.
So think about that. That's like 5 ml. So think about a tablespoon, teaspoon, like that you use 5 ml. That's the maximum that is expected to be in a day.
That is considered normal.
Normal,
okay.
Yes. So to have vaginal discharge is normal. 2.5 ml to some have less than that, but depending on where they are in their cycle.
Okay.
So that's that. Then of course consistency changes as well. As we go through the different menstrual phases when we're talking about it, I'll talk about why it changes and what it does for you naturally when it's changing. So then the smell. I've seen a lot of people, they want to turn their perineal vulva area into a perfume factory. It's not supposed to be so, and we'll talk about it a bit more as well. There could be an odor, but it should be mild. What do I mean by mild? Like you yourself, if you see your own underwears or if you check your things, you should be able to smell, but it should be mild. Mild is the key word. You shouldn't be sitting by someone and then someone can smell from there. That's already out of the mild range. But you yourself can tell what your own private items are just by the mild odor. So even if it does have sometimes it could be odorless, but even when the odor is there, it should be a mild odor. So basically like gentle odor. And I don't even want to use the word odor. So maybe gentle smell or mild smell. It shouldn't be pungent or very concentrated. Okay. So yes, having a vaginal discharge that is clear, white, off-white, mild odor, about 2.5 to 5 ml throughout the whole day, it's considered normal. Like a normal vaginal discharge. Is
it expected that a woman would see a vaginal discharge every day of the month? Is it normal? Is that normal?
It is expected, because how do you know? Even without having like a significant discharge, if you've worn your underwear all day, you'll see that by the time you get home and you're changing, you'll still see some degree of discharge on your underwear. Okay. So those that use panty liners, you'll see. What you can follow through on, however, is sometimes it's more and sometimes it's less. Sometimes you may not even see it on your underwear, but when you're cleaning up or having your bath, you actually see a little bit of discharge. You can't really quantify it or anticipate it, because like I said, it varies with a lot of internal and external factors. So yes, but what I don't want women to think is that they are not supposed to have a vaginal discharge. They are supposed to have it in just like the terms we described, and that the smell. And I will also talk about some of these feminine products that women use and how it can be a disadvantage to even a woman's vaginal discharge as well.
So if a woman does not have a vaginal discharge, should she be concerned?
So it all depends on where she is in life. Because again, and I'm going to give an example of menopausal women. Okay. One of the leading symptoms for menopausal women is that they have very serious vaginal dryness. That sometimes even leads to bleeding when they clean up or when they're trying to be intimate with their partners. So it's basically like even that discharge or lubrication has dried out, that we have to help them to even gain lubrication back so that they can have a good sexual life with their partners and even stop bruising at normal activities like cleaning. So again, I don't want to use the word normal or abnormal. I think everything depends on where a woman is in terms of age, reproduction, and even what she's exposed to in terms of medication and family planning options that she's using.
Okay, so but if we're going to say a young lady who is still in her
like peak reproductive, yes, you should anticipate that you will have vaginal discharge. Yes.
Okay, so moving on from there, let's talk about the different phases. The last time we had a conversation, you took us through the different phases of a woman's monthly cycle. You talked about the menstrual phase, the follicular phase, the ovulation phase, and then the luteal phase. See, I'm learning.
Yes, you did well.
And then you took us through the different hormones that a woman goes through. If you haven't seen that video, go check it out. I'm going to put the link to it in the description box down below. So check it out so that you can understand this conversation a lot better. So you said earlier on that at the different phases of a woman's menstrual cycle, there are different types of vaginal discharges. So I know for menstrual phase, the discharge is the...
So for menstrual phase, you are likely not to be able to tell the difference because it has become a component of that menstrual.
Of so many things.
It has joined the blood, the layers, all the things that are coming out. It is coming out with it. But you will notice that towards the tail end of your period, after that brownish phase phases out, it almost feels like you have close to nothing after the period is finished.
Okay.
Like it's almost like everything has like calmed down and dried out. Right? Remember that the period is ending, the follicular phase is in full action, which is where you're growing the eggs again. Again, another building up is also starting in your vaginal discharge. So you can notice that you went from bloody to brownish to almost no discharge, and then you start seeing discharge again. They can be a bit creamy, a bit cloudy, but you will notice that as you're moving on in your cycle, as the days are going by, it is getting more.
So at the follicular stage, it is creamy,
cloudy.
What's the texture? Is it thick, light?
So it can vary.
It depends.
It depends on where you are, because again, you can't really anticipate it per se. You just know that, okay, my discharge is just there. I can clean up and see something there. Some will tell you that, oh, I have, like someone that has like a lot of discharge, maybe someone that has like an IUD with a thread that is there. You can't quantify, you can't anticipate how that will interact with what you have going on down there. But you know that it's creamy, it's cloudy. Even if it smells, it's mild.
It's mild.
Nothing pungent or offensive. So you notice that. But as a woman is getting close to ovulation, remember how we talked about close to ovulation? Your happy hormones are jumping up and down. You have energy.
Yes.
You will also notice that there can be a transition from that creamy, cloudy to the volume will first increase.
Okay.
It becomes more close to ovulation. It becomes clear. You remember it was creamy, it was cloudy, everything was, they were building. Then when the build is to that ovulation period, where everything becomes clear and more and sort of wetter, and then that's when you see the slimy. When women talk about, oh, they can use their cervical mucus. It's almost mucoid in nature, but it's clear, it's wet. And the whole idea, even the pH, that's the acidity, even changes then. The whole idea is to allow sperm to pass through in order to increase the chances of pregnancy happening as well. So as the eggs are growing to allow for pregnancy, as the lining of the womb is also preparing to receive pregnancy, the vaginal discharge is also helping the sperm to travel so that everything works together.
We need to work. Can we give it up for God, please? Like what? Are you serious?
Yes. So it's like everything is aligning together to allow fertilization to happen.
Oh my! So wait. Does that wait? Things are getting interesting. Does that mean that sex is easier during the ovulation period?
It is easier because there's more lubrication, and even there's a slight increase in even the libido of the women during that time as well. So everything is geared towards achieve pregnancy. So even the vagina, so it moves from that creamy, cloudy that you see or whitish during that follicular phase. When you're close to the ovulation, of course, and all of this is under estrogen. Remember that estrogen is the builder. So all of that happens and then it becomes stretchy. So for a lot of women that are tracking, trying to know when they are likely to be fertile, one of the things they check is that their cervical discharge. Once they see that it's mucus, it's drawing, it's clear, you know that, okay,
you better go do it.
A lot of women do it already.
You better go do it.
A lot of women do it. So they already know. So the whole idea of that is to make it easier for the sperm cells to travel along the female reproductive tract so that fertilization can occur and then subsequently pregnancy. So we've moved from the menstruation where it's kind of scanty as you're coming out, follicular phase, creamy, cloudy, ovulatory phase, clear, stretchy, wet, everything to just enhance pregnancy. And then once we've ovulated, progesterone takes over. So remember it was estrogen in the first phase, progesterone takes over. Now, what is the role of progesterone? Progesterone is anticipating that, okay, let's say you had sex, you're likely to be pregnant. It changes, remember that the way that thing becomes slimy and liquid, it makes sperm able to go up. It also means that if it doesn't stop that, something can come down. So the cervical mucus, the mucus again, the vaginal discharge changes and it becomes thicker. And in a way, it's blocking anything from being able to come down. So even if you're having sex, it's not likely that the sperm can even go anywhere because the vaginal discharge has changed. Moving from when it was supporting the sperm to when it's now almost like it's closing the entrance to allow if anything is happening there to happen. And even at that time, a lot of the changes that happen beyond those physical changes you're seeing is even the bacterial, because we do have good bacteria, which we're still going to talk about. They also produce more acid so that if there's any infectious things that is around, it plugs it from being able to come up. So it changes. And then of course, when you don't get pregnant, all of this wahala that your system has done, everything comes out as all of those preparations, the thick mucus, everything comes out with blood. In the lining of the womb, everything comes out again as a cycle.
Wow.
And that's how the cycle continues. So the one your period starts, 2, it builds up again, it ovulates, allows for sperm. After that, it blocks in case there's pregnancy afterwards. If there's no pregnancy,
interesting. So this cycle thing is brazy, like, oh my goodness. I think the one I find the most interesting is the ovulation.
Yes, because everything's aligning.
So I have a very sincere question, because I've heard a lot of, or some women complain about dryness, even before they reach menopause. Yes. They complain about dryness in their vagina, and then because of that, they're not able to enjoy sex, and then they are using all kinds of things to get that place to become wet. Do you advise that the woman uses external measures to get the place wet, or just follow the natural course of things, and then maybe during the follicular phase, if it's not as wet, just know that it's okay that it's not as wet as when you are in the ovulation phase? I don't know if you understand the question.
No, that's dicey to do.
Okay.
Because again, that means you're structuring the sexual life of a couple. So you're constraining it to a particular time.
Yes, but if a woman is not getting,
then you should find out what is causing it. So it's not so I think one of the things that happens a lot in our society is that a lot of people self-medicate. So even when a woman is dry, in quotes, she just probably checks online, or she goes to a store and picks up something that is causing it. Remember that I told you that estrogen is the builder. For some women, for one reason or the other, which may be even something they're doing they don't know about, they are the ones suppressing their estrogen level. So if you correct that estrogen level, all those things that are not happening will happen naturally. But if you are buying like external lubricants, it's like you're dressing a wound, but what is there is still under it. You're not dealing with the cause. Again, because what happens for a lot of couples as well, and I've seen there's a lot of couples, is if you restrain their sexual intercourse to ovulation period, it becomes performative and takes out the pleasure from it. So they begin to, even the men start to complain that it's like I'm a stud. I'm only necessary at this point of the.
No, but the reason I said that, you said that at that ovulation period, the discharge is stretchy, it's slimy, it's wet.
For conception.
So when it now comes to the follicular period, when it's not that stretchy and the vagina seems a little dry, how do we make it moist?
Yeah, so that's what I'm saying. That so it shouldn't be relative to one another. The wetness of ovulation is to enhance fertilization or having pregnancy. A lot of people don't have sex because they want to have pregnancy achieved.
But we still, the men,
do you understand?
But it still needs to be for penetration
exactly
to happen.
Yes.
A woman's vagina still needs to attain a certain level of moistness. Yes. So should a woman be concerned if at the follicular stage her vagina is not wet?
No, if a woman is, so you see, wetness is relative.
Okay.
Because again, what do you mean by saying a woman's vagina is not wet? Is it that she's having pain when she's meeting with her partner? Because if a woman is having pain, as out of dryness, is different from if she's having pain, despite the fact that she's wet.
Okay.
For some couple, all they need is counseling. Maybe they don't have adequate foreplay. But for some women, there is something else they are doing. Some women is even douching and all this feminine wash they are using.
Yeah, that's what I'm saying.
That is changing their pH. So it's to get to the underlying cause of that dryness before you can decide on how best to address it. And of course, not to compare cycle to different phases of your cycle. Even sexual intercourse is not the same at all times. It's not maintained at the same pace at all times.
True.
So it's the same way with sexual performance from the male partner, the same way with the vaginal discharge. These things are lubricants. Even if a woman is in a happier mood, is likely to, all of this work together. It's from the brain.
I agree.
Exactly. So it's not just about locally lubricating it, but there are some cases that is the option. There are local measures that are taken to improve us to moisturize the vagina. None is bad. It's just that you shouldn't self-administer. And then you shouldn't just use anything just because they say it works. Because find out what the problem is. Because a lot of ways, and I'm sure we'll get there, women trigger these anomalies, and then when they kind of come up to treat it, we have to undo all of that that they've done already. Yes.
Interesting conversation. I didn't even know it was going to get to this point, because mine was just focusing on the discharge. I didn't know that at a certain point in the cycle, the discharge becomes what it is to aid.
For nature, yes.
God is good, guys. God is good. Okay, so Dr. Lewu, this conversation is getting interesting. And then this next question I'm going to ask is from a place of some things or things I've seen happening online on social media, and even things I've even seen with people around me. Some women go the extra mile in trying to keep that place clean, in trying to tighten it, in trying to just do all kinds of things. I've even heard of a woman say she puts garlic cloves. Sorry, is it? Yeah, garlic. She peels the garlic and then puts it in the vagina for what to happen? What are your thoughts about this? And then how does it affect the natural? I know you talked about the natural occurrence with this vaginal discharge. How does it affect? And then would you advise that women go that extra mile in trying to keep their vaginas clean and safe and tight? It's that tight one for me though.
So I will say that the vagina is maintained by nature at a particular pH. So one would say pH is the measure of acidity, and it's usually between 3.8 and 4.2.
Okay.
Some cases 4.5, but 3.8 to 4.2 is optimal.
How can a person measure? Do they have to come into the hospital?
No, they don't even have to. That's at that point, nothing is happening, just having normal vaginal discharge.
Okay.
We measure sometimes when a woman comes with symptoms.
Okay.
And then, of course, we're now checking that what could be responsible for the woman's symptom. That acidic nature is maintained by good bacteria that we have naturally occurring. So it's not all bacteria that are good, that are bad.
Bad.
So we have what we call flora, like it's natural, normal flora. It's part of a woman's private part to have all of this in their vagina, this bacteria. The predominant one that we all kind of know about is what we call lactobacilli.
Okay.
And what happens is that lactobacilli and all other good bacteria that are in the vagina, their role is to maintain that acidity and also prevent the bad bacteria from coming in. So it's like a colony. They are the ones there. If you kill them off, either by inserting things there, by altering the pH, by using medications indiscriminately. I've seen people that have been on antibiotics for 6-7 months. They've killed the bad, they've killed the good, they've killed everything there. So it's like a fresh ground for anything to come in there. So for a woman, I would say, know that the vagina is self-cleansing. So it's the vulva that women should watch. I would love if you can put a picture. What you are washing is the vulva. That's the outside from your labia. Outside, you can wash between your buttocks, like everywhere outside, even the entrance. But putting your hand inside to wash, no, it self-cleanses itself. Everything that is unhygienic there comes out as those vaginal discharge. If it's too much, it will come out. If you are treating it with either a local medication or something you're taking by mouth, everything will come out when it's time. But you putting your hand in there, you're already tampering with nature's process. And in the process of doing that for a lot of people, all this putting supplements, putting on prescribed stuff right in the vagina alters that pH, disturbs the natural good bacteria that are existing there, and now allows the bad ones to overgrow in a lot of cases. So for women that do all of that, it is not helpful. And then for some women, even the mild smell is what they are treating with a lot of vaginal washing inside their vagina so that it's smelling like a flower, like a perfume. That is not the natural smell. And those things you're putting there, they are altering the pH and they are killing off the good bacteria that are supposed to protect your reproductive tract.
Then what happens when your pH level is altered? What are the symptoms you see? Does it include things like dryness?
So that could happen. So the dryness in itself could come because if you look at some of these vaginal discharge that people complain of, once you start having that thick one. So let's give example of candida. Most of the women, they tell you that it was initially creamy, then it looks like cheese, it looks gaudy. Then after a while, they have bruises around that place. Even when they try to put medication in the vagina to treat, the level of pain they feel, it's a lot. So you can alter it. It can cause dryness. And then if you're also using some certain medications, they can have impact on your vaginal discharge, depending on what is being managed for.
So the advice is leave your vagina alone.
Leave your vagina alone if they are, and we are talking about those what bothersome.
Yes.
Leave your vagina alone if there's nothing worrying you. But if there's something worrying you based on symptoms or based on actions you've taken, seek help.
See a professional woman. I think that's very good advice. Still touching on this thing you've shared about the good bacteria and the bad bacteria. Are there things that a human being can do, or a woman can do, like her diet? I know you're not a nutritionist, But are there things that can help the good bacteria thrive in the vaginal region? Like, can the diet help? Can exercise, sleep, reducing stress, do all that contribute to the building of the good bacteria in the vagina?
Absolutely. What you eat, there's a correlation between, gut health. I'm sure you're very familiar with it, and your general well-being as a woman. So the more healthier you are, the better your vaginal flora will be, the better your immunity will be, the better your ability to clear out infections or anything that is in excess will be. So yes, there is. I find that healthy lifestyle is a win-win. I'm always talking about reproductive health and healthy lifestyle. You can't go wrong with it. However, if you now even have specific medical conditions, so let's say for instance a woman is diabetic, this is something that alters the pH of the vagina a lot. In fact, one of the things that makes some women finally go and get screened for diabetes is this persistent vaginal discharge, itching, infection that is not responding to medication. And then by the time they come and check, we find out that they are actually diabetic or their glucose level is off the charts, and that is what is affecting it. So for some women that even have conditions that they don't think they are related, they have chronic medical conditions, immunosuppressive medical conditions, maybe infections, they are on treatment for even cancer. All those things that bring down the immune system, they affect the vaginal discharge that the woman has. And another natural thing that affects it is pregnancy. Pregnancy is amazing, but it also keeps the woman's immune system down and also changes the pH. So we see a lot of pregnant women coming into the hospital to treat vaginal discharge. So all of these things, they come into play. The bottom line is that don't self-medicate, because if you over self-medicate, you can kill the good bacteria, and that allows the bad ones to take over.
Please, there's a question I want to ask here. I've seen this thing. Women go crazy about it. They say you blend pineapple, you drink, your thingy smells like pineapple. Please, is that true?
That is outside of the scope of my medical training. That is outside the scope of my medical training. But I wouldn't say no. If you remember that there were some antibiotics that we used to take when we were kids and it used to smell on our skin. Can you remember? Like there's some medications that you take and then if you belch, or if you wee, it smells. I don't want to mention brands. So who knows?
People things like garlic.
Exactly. True. Like if you take. So who knows? Maybe the people binged on pineapple so much that it's smelling everywhere. I don't know. But it's outside my scope of work. But I mean,
please
people
don't
try a lot of
drink
things.
too much pineapple juice. There's sugar in that thing, I beg. So you don't end up with diabetes.
No. It's not even that. I think people should just normalize the fact that the vagina is not meant to smell like fruits or perfume.
Yeah.
Exactly. It's this incessant obsession with trying to change the smells. It's flowery. I've had people complain that, their partners are even complaining that their under is not smelling. Then when we check, but there's nothing on saying, but they say it should smell.
No, these are unnecessary expectations from your partner,
and even from they themselves. Because people think that is the proper way for it to smell. But the truth of the matter is that you may be altering your natural flora. Another danger of that is that when you are so used to douching and perfuming up, if something is wrong, you will not pick it on time. So you are used to packing perfume. You have eaten maybe 10 dozens of pineapple. You've used this one, you've used that one. An infection can start and you won't pick it on time. And the danger of infection for women is not even in the discharge or the itching. It's the fact that it has capacity to climb up and damage the womb. So even if you are overdoing all of these things, it will take... You can miss 1 or 2 weeks that we're supposed to have caught these infections early and taken care of it because we are masking it. So it's a dicey situation to become addicted to it as a normal process for your hygiene.
Yeah.
To hide things or mask them with nice smelling scents.
Interesting. So apart from the things that you insert, do you recommend things like sprays? Because I know women who spray things there,
inside.
Not inside, just at the surface.
They don't need all of that. Just mild soap, have a bath and wash. That's enough. No need for all of that.
I'm giving you water.
I don't know. People talk about endocrine disruptors. I don't know if it's something you're familiar with. You hear a lot of people that are really passionate about it. That even say the normal body sprays, normal perfumes, they are distorting hormonal systems. And you are now going there
to add more by yourself with your own hands.
So it's not necessary. So long as it's mild, fresh, clean, that is all that is required of the vaginal discharge of the area.
Thank you. Okay, so moving right along, right? you've explained what a normal discharge looks like. Can you give us a brief, or try to differentiate between a normal discharge and an abnormal discharge, and then share with us some typical signs of infection that can be detected through the different discharge that a woman has to her vagina?
Okay, so for abnormal discharge, sometimes there are different things that changes. So remember, we talked about the natural way that the color changes as the cycle is at different phases. We've talked about, so far I've mentioned white, cream, off-white, clear. They're all in that space. Once you start seeing things like grayish, you start seeing something like very yellow, thick, cordy discharge, some green.
Really?
Yes, some really, really brown, and it's not like related to your period, then you should go and get it checked out.
Okay.
Now, it is very important, and that's just color. Some is volume.
Okay.
What I mean, we talk about most times it's like teaspoon and all of that.
Teaspoon.
There's some women that when the discharge gets so much, they actually wear the sanitary towel they need for their period just to take care of the discharge that they're having.
Really?
Yes. So you look at the color, is it changing to outside of the regular color that is expected? If you look at the volume, or some people are not using panty liners, they're finding that their clothes are getting wet from discharge, not urine. Now, we also talk about odor. Remember I talked about mild. Some women have change in the odor of the vaginal discharge that even as they're sitting side by side, you can smell that something is off-putting. So some people, the smell suddenly becomes very pronounced. There are specific ones. We talk about fishy smell for some women, offensive smell. Even they themselves, they know that this smell is not it. So if you notice that the smell is not good, it's too concentrated, it's too pungent, and it's offensive, fishy odor, is the problem. If the color deviates away from those normal ones, is a problem. If the volume increases significantly, it's a problem. However, I would like to bring into attention that beyond even the discharge itself, the associated symptoms it comes with can also alert you. The discharge may not have increased much, but you're suddenly itching every time. Or you're having, when you're urinating, it's burning sensation around there. Lower abdominal pain, like very bad lower abdominal pain, feeling feverish. Sometimes, even if you're sexually active, having sexual intercourse with your partner is so painful, like anything touches that vagina introitus, you are in deep pain. All of that, don't even wait until the discharge is plenty or the color has changed. If you're having all those associated symptoms, you want to quickly go and check up. Another thing I talk about is that, sadly, it's not all sexually transmitted infection that is symptomatic. So I always tell people that if you know maybe you've engaged in an unprotected sexual intercourse with someone that you're not aware of their status or your status, you should quickly go and do a check-in as well. Because sometimes some of these infections just come very mild and disappears, but they are still there, lingering, destroying the lining of the tubes. And because one of the most common cause of infertility in our environment is something called PID. That's pelvic inflammatory disease, and most of them come from infections that affected the tubes. So all of that is very important to know, that it's not just the change in even the vaginal discharge alone. It's the fact that if you're having all those associated symptoms, you should quickly go. It may be false alarm, but you need to quickly go and check it, especially if you're sexually active already.
Something I hear you say is ladies that have sex up and down, trusting somebody
trust
without
but verifying.
like trusting a person, a man, a partner, and then not knowing their sexual condition or whether they have...
For both parties, actually.
Yes,
so
yes,
if for the male and the female partner, if you're engaging in a sexual relationship, you should know your baseline. Even now, religious organizations ask for blood group, genotype, if you want to get married. Even some do the STI panel before you commit to one another. So you shouldn't...
So I'm not even talking just married now. You know, people have sex outside marriage,
yes.
which
so
I don't
yes.
recommend.
So I'm just even saying
advise.
that I'm saying that even within the confines of religion, people are checking. So if you are believing in the non-religious one, you have to check.
You must check.
So you know the status. If you go online, you see a lot of comments on people's pages where people send all these anonymous messages, how they met somebody during Valentine, met somebody during 30 December, now they are having serious discharge, itching, they went to check, they have chlamydia, they have gonorrhea, all of these things.
Because it's really crazy that you meet someone at the club today, and then you go follow them to their houses, and then by the next month you guys already had sex.
And then
how do you know what he has, and how does he know what you have? You just exchange things. So. Ew.
So You're making me laugh, Queenie. So genuinely, so sometimes you don't even have to wait till the symptoms come. If you've engaged in high risk behavior, it is worthy to quickly check. And if you need to treat, you need to treat. Because again, like I said, beyond the symptoms, sometimes you treat it later, but it has already damaged some of the reproductive tract that a woman has, or even the man in some cases, not just the woman. So it's important to know that the vaginal discharge is healthy, normal, natural, but there are certain things you see that makes you know that you need to.
So the symptoms like the itchiness,
the itchy is more. It's the smell,
smelly,
color outside of the regular color that is expected, lower abdominal pain. If you've engaged in any risky sexual behavior, don't take any discharges at high.
Can I also ask if having because I'm big on nutrition. I'm a nutritionist in training. Yeah. So I'd always ask, right, does a poor diet or a poor lifestyle affect or show symptoms of infection in the vaginal area? So for example, if you don't eat well, or if you're eating high carb, simple carb stuff, does it show?
It will. Okay. Because again, one of the things that the lactobacilli, the good bacteria that I talked about, one of the things it does, depending on what phase of the cycle, is that it helps you to build glucose storage, what we call glycogen. And then when it gets to the luteal phase, lactobacilli and other bacteria, they help you, under the influence of progesterone, they break down the glycogen storage. One of the things we notice is that if a woman has an unhealthy lifestyle or unhealthy diet, you can disrupt all of this process. And even beyond that is that in an unhealthy lifestyle, especially if it's associated with weight gain, obesity, being overweight, is that even your ability to keep the perineal area dry reduces. And then because unhealthy lifestyle is associated with metabolic conditions like diabetes, hypertension, like having abnormal cholesterol, all of these end up affecting that pH as well. So it's a win. You know me. It's a win-win. Like
I see.
You can only do well with eating well, and not by even what you put in there. It's what you put in your body that sort of manifests across board. Yes.
Again, we're back to this healthy lifestyle thingy. Dr. Lewu is a big advocate of eating healthy, living a healthy lifestyle, sleeping well, avoiding stress. Just please, you people should embrace this healthy living. I beg.
We're trying.
And that's actually
it's hard, but we're trying.
One of the major reasons I brought up this segment on the Zeelicious channel, just to talk about this, have this conversation, so that you can understand how not living a healthy lifestyle is hampering with a whole lot of things in your life. And again, I'll still say, if you want to start the journey to eating well and eating healthy, I have an array of meal plans that you can choose from a low carb meal plan to high protein to a detox to weight loss plan. There's a lot. Just check the link in the description box down below. Check out the array and then find out which one fits your dietary preference the most. Access it, download it, and start using it today. Please, I beg you people. And then, of course, we also have a series of healthy recipes on the channel. I share healthy recipes, easy to make recipes that are Nigerian friendly for those of my Nigerian brothers and my African brothers and sisters that like their local food. I share healthy recipes as well that you can relate with. So please, 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 the long and short of this matter is do well to live a healthy lifestyle by eating healthy, and then, of course, performing the healthy activities that you need to perform. Okay, I have a few more questions before I let Dr. Lewu go. Okay, so Dr. Lewu, we're making so much progress here. The next question I'll ask is, what's the best way to fight a vaginal infection or something that is not, you think is not right?
You think something is not right, go to the hospital or clinic, seek a professional care for it. Like I said, it's not just about the system. It's just not about the symptom, rather. If you feel that something is not right with your vaginal discharge or with your vaginal health, please go to the clinic, hospital, or seek care immediately. Okay. And this is because of the potential of it damaging your reproductive tract if left too long before intervention. So if you think something is wrong, go in there, not self-diagnose or self-treat yourself. Like a lot of people that have done that, some will do it and then come to the hospital even afterwards because there's no improvement. So it's best to seek care if you think that something is not right.
Okay. Yes. Okay. So no self-medication over here. Go check out a medical practitioner. She's an expert in women's health. I'm going to talk about how you can reach her just in case you have a problem or two that you would want to talk to her about. And you can reach her directly on. Another question I have is, what causes a person's vagina to itch? That's a very common thing.
Yeah, it's very common.
Sometimes in public, you even find people
You can't have a, sometimes it's not, sometimes it could be just shaving, like shaving the wrong way. Like not necessarily like there's something wrong. Sometimes depending on what you use to take care of your pubic hair, it can be associated with shaving. So that's mostly around the vulva and around maybe the introitus, not inside. Okay. Another thing that can cause itching could be poor hygiene. So we're not even talking about maybe any infection or anything. You don't have good hygiene practices. Maybe you're overwashing, maybe you're douching. For those that use tampons or cups, maybe you're not maintaining maximum hygiene that is necessary. So hygiene is key, right? Then of course it could be infections. Okay. Those ones too can manifest with itching as well. So think about what are your shaving habits? Is there any infection? Am I having poor hygiene? Sweat. So that's the hygiene. So the place is moist, like overly moist. Even sometimes the itching comes from people that still prefer thong and all of those kind of insertive kind of pants. Especially if it's small or tight. Yes, so it can make you uncomfortable.
What kind of pants would you recommend?
The best has always been cotton. Like everybody talks about cotton, but people still do nylon, polyester and all that. But cotton is always best. Breathable cotton.
For my tongue ladies.
Breathable cotton, and then maybe buy a size bigger so that it's not putting it's not tight.
So at least we now know that itching is not necessarily just from infection.
It could be from other things.
It can be. So check other things first and be sure it's not other things before you.
No, let's not check other things first.
Okay.
It's when they've checked and there's no infection, they can go and think of other things.
Okay, that makes sense.
Before they come and carry chlamydia and be checking.
That makes sense. So I have two more questions, right? The first one is, how does vaginal discharge change when a person is pregnant and then when they hit menopause?
Yes. So for the pregnancy is such a beautiful state. Anything can happen in pregnancy. You're like a queen in your own kingdom, bringing forth babies into the world.
I love it.
But it's known that pregnancy in itself is an immune suppressive state. So your ability to fight infections, your ability to withstand stress reduces in pregnancy. Just because you're carrying another human being in you. So with pregnancy, even women that used to have yeast infections or candida, they just find out that it is more. And then also pregnancy changes because of the predominant hormones in pregnancy. Progesterone is one that sustains the pregnancy. There's still others, but that's the predominant one. It also alters the pH, the acidity thing I talked about. So that allows overgrowth of a lot of bacteria that normally would not overgrow. So that can be seen in pregnancy. More discharge, sometimes more recurrent candida infections just because of all of that happening. Now for menopause, again, one of the key changes in menopause is that a woman's estrogen reduces significantly. Remember how I talked about the effect of lactobacilli under the control of estrogen? Yes. All of that begins to happen. So all of those changes leads to like vaginal dryness. A lot of things comes with it's a whole. For women that do have the experience that they have troublesome menopause transition or post-menopause state, it can be a lot. The dryness, like I said, it can impact their sexual relationship with their partner. Secondly, it can even cause them to have recurrent UTI just because space is always dry. If they clean, it will bruise. Everything just feels a bit stressful. So for those women, they have to seek help. Just to live a better quality of life. Yes. Okay, so and then for people who have an active sex, this is my last question, by the way. For people who have an active sexual life, you've talked about the normal vaginal discharge. For those who have an active sexual life, can that sexual life they're having alter the normalcy of? Yes. But one of the interesting things that happens is that, we've talked about the fact that the vagina is acidic. The semen is not. In fact, when the semen is introduced into the vagina, it alters the pH.
Why did God do all this?
No. The acidity is to protect women. Okay. And even when the semen when the semen comes in, it changes the pH as well. And so in its one way, it's good for pregnancy. Like if you're trying to achieve pregnancy, it's a win-win. But it can change. Couples that use sex toys, couples that use
really?
Yes, because again, if they use lubricants and all of those things, they are introducing external factors into the vagina. So that in itself, even couples that do some sort of foreplay, hygiene is important, because if your hands are carrying germs and all of that and dirt, you're introducing
The people who even masturbate.
If it's unhygienic, you're introducing it into the vagina. So all of that can alter it.
But I would ask a question, right? Since the vagina has the good bacteria, when the bad bacteria is introduced, does it combat it?
It does. But then again, remember that there are super bad bacteria.
Yes.
So like the ones that come from maybe not having enough hygiene, if you have a good vaginal flora, you may be able to overtake it and there won't be any infections. But that does not apply to when you talk about sexually transmitted.
Yes,
there's
definitely.
no good bacteria that is fighting gonorrhea. No good bacteria is even fighting HIV.
True.
No good bacteria is fighting chlamydia or syphilis. So those are different. But all those hygiene issues, so it's important for your sexual partner and you to be aware so that you're very, very conscious of the hygiene.
Clean.
And even the barrier methods and condoms that some people use, some of them are flavored. They've added a lot of lubricants to it. It can alter the vaginal discharge. So you hear a lot of women say that, okay, they find that they have more discharge. Sometimes it's not even just the discharge, it's the semen coming out. But for some people, it takes a longer time to come out and they maybe say, okay, this thing is smelling, I feel like something is wrong. So you just kind of take history to be sure of what is really happening. But yes, sexual activity can alter the vaginal discharge.
So I think for me, the take home is for women watching who have a sexual life, an active sexual lifestyle, and I believe it's only married people who have a sexual lifestyle, because I don't advocate for sex before marriage. So if you're having sex, if you have an active sexual lifestyle, it's important that you tell your partner to please wash his hands. If possible, wash, so that they're not introducing bacteria into that. You're clean. People understand what I'm saying.
I understand how your hand moves.
Dr. Lewu, it's been such a delight having you on the couch.
So
What? Do you know, I learned so much. The one thing I'm taking away from this whole conversation is what happens in the ovulatory phase when the discharge becomes slimy, nice, just so that it can aid
the sperm to travel.
God is good. I'm still holding on to that. So if someone wanted to reach you, if someone wanted to contact you, maybe they needed you. I mean, I know I asked the best questions that I could based on this topic, but if you have other questions, or if you have conditions and you want clarity, you now need to consult Dr. Lewu. So how can they find you?
I'm on X, I'm on Instagram, and also have a YouTube channel. So across what you see at Soft Life Gynae. I believe that every woman deserves a soft life, so I'm an advocate for that. And then I also consult where I work. That's the Hub Women's Clinic, is in Anthony Village, Lagos. And I think you're going to drop the number.
Yes, I will, definitely. And the website and email.
Yes, so they can reach out to us.
And I'm going to put all the links to her social media page in the description box down below. Do you have a book? Not one yet.
Well, funny enough, I do have a book, but the book is it's targeted at younger girls, so it's for men. It's like menstrual education, but it's a storybook format. Okay, so where can they get it? I can drop the link as well.
Okay, yeah.
Blooming Flow, yes.
It's nice for younger women to actually have this information. So I'm going to put all the link in the description box down below for you all to check it out. But please join me to say a really, really big thank you to Dr. Lewu for coming on the couch.
Thank you for having me.
And sharing this wealth of knowledge with us. Thank you so much. It means so much to us in the Zeelicious community.
Thank you.
Thank you.
It's always my pleasure.
And I'm bringing her back because we have a lot of other topics to talk about under women's health. And please, please, please go into the comment section and
let's gist.
Let's have the conversation there. And then, of course, if you have some any topic you want us to touch on relating to women's health, also leave us a comment in the comment section down below. Dr. Lewu will be there. I will be there looking out for your comments and responding to as much as we can. That's pretty much all that I have for you today on this segment of On the Couch with Winnie. This conversation today was very, very much valuable. I know I learned a thing or two, and I'm sure you too learned something as well. And if you did, please leave us a comment, like I said earlier, letting us know what you learned and how it will be helpful in your own life going forward. I'll see you next time with another valuable topic on the Couch with Winnie. Until then, remember to continue to live a healthy lifestyle. Take care.